Hi, I'm Dr. Fred Abeles. There's as many treatment options for migraines as there are doctors to provide them. How do we choose correctly? If we make the wrong decision, we can end up with failed treatment results or worse yet, serious damage. So it's important we make the right choice. That's why I put together this short presentation. The first essential thing to know is, does the treatment address the primary root cause of the migraine? Many popular migraine remedies focus on temporary relief of symptoms. For example, pain pills, muscle relaxants, anti-inflammatories, biofeedback, massage, chiropractic. I'm mentioning just a few. But if the underlying tissue that's causing the pain isn't clearly identified, the pain will continue. It's just that simple. So first, be certain the treatment addresses the primary root cause of the migraine, not just the symptoms. Treating the root cause can dramatically improve the outcome. The second essential thing to know is, will the treatment last? For example, Botox injections have been FDA approved for the treatment of migraines. They temporarily freeze or paralyze the muscles of the head and neck that cause the pain. It works, but the therapeutic benefit doesn't last. It has to be reapplied every 3 months. So the question most people don't ask but should is, if Botox relieves migraines by temporarily freezing the muscles of the head and neck, is there a treatment alternative that lasts so the muscles don't create pain? Well, it turns out there is. There's a breakthrough technology I can almost guarantee most people have never heard of, and I'll reveal the details in a minute. Yet not only is the mainstream press not talking about it, they're still encouraging people to take all the drugs shown in the TV ads. And if the treatment approaches with pills and drugs don't last, shouldn't we ask ourselves, are we okay with having our liver, our kidneys, and our stomach take the hit for repeated use of these medications? They all have damaging side effects. Which leads me to the third essential thing to know. What are the side effects? We've become a nation of pill takers. We see an ad on TV for a new drug with all the smiling, dancing people and the happy music, but we don't pay enough attention to the last minute of that commercial. That's where they mention all the things that a wonder drug can do to us. Most of these drugs have serious side effects, and some are life-threatening. What many Americans are learning the hard way, there's no magic pill. There's no quick fix to chronic pain. And I know this sounds harsh, but anyone can wear a white coat on television. Not everyone knows what's best for our health, especially if their interests are first served by selling us drugs we continually have to go and refill. The fourth essential thing to know is the doctor a specialist? There are many wonderful health professionals who sincerely want to help their patients, but the question is, do they treat this full-time or just occasionally? Expert status is only achieved from treating a large population of patients with one specific problem. Anyone can treat headaches by writing out a prescription, but to specialize in the field is something else. Don't settle for anything less. The last essential thing to know is the root cause of the migraine TMJ dysfunction? TMJ, or temporomandibular joint dysfunction, is a frequently misdiagnosed disorder, and it can be the root cause of many migraines. The temporomandibular joint is located right in front of our ear. It attaches our lower jaw to our head, and it's the only joint in the human body that's positioned by our bite where our teeth fit together. If someone's bite positions the lower jaw and the jaw joints incorrectly, and that discrepancy can be as small as 1/10 of a millimeter, then the muscles of the head and neck that support them and stabilize them can fatigue, they can stress, they can even go into spasm. And the dysfunctional muscles can wreak havoc with our head and neck. It's called muscle hypertonicity. The muscles are always on, they're always hot, they're always firing. And if this goes on long enough, the muscles can produce pain, and lots of it. It's simply incredible, but if we get the bite right, if we get the muscles of the head and neck to function right, the pain goes away for good. And there's some amazing new technologies that allow us to do just that. My advice, don't settle for Botox temporarily freezing muscles anymore. Don't settle for symptomatic relief. And don't rely on prescription drugs with side effects. We can stop migraines in a far better way. This is the most exciting development of my career. We've hit an inflection point, a time where technology can replace drugs for migraine relief, but there's more to this story, much more. I hope everyone is as excited about this breakthrough as I am. Thanks for watching.